Okay. First question. um, what was your favorite treat as a child?
I never had candy or treats until after I was a teenager. So I had no favorite treats as a child.
What about when you were older?
Hmm. Maybe ice cream.
Ice cream. Okay. What's the worst flavor of cough medicine?
Hmm. Um, I don't know. Um, I don't have any worse flavor of cough
Do you
medicine.
have a favorite one?
Well, yeah, in the day, Cheracol D,
Ooh.
that was the best cough syrup on the planet.
I used to think grape was the terrible flavor.
I never had
It's
grape.
just it's like ugh. My dad used to give it to me, and my mom knew I didn't like that flavor, but my
Oh,
dad just
no,
kept buying
I never
it.
really had cough syrup until I was probably an adult and could buy it for myself.
Mm, okay. What is the earliest memory you have of visiting a nursing home or hospital?
As an adult, um, there were several of us that would go to nursing homes and take magazines and just talk to the people, um, just to visit
Hmm.
because they didn't always have somebody that would come and visit them.
Okay. What are your feelings about hospitals?
I prefer to stay out of them.
Mm.
They're noisy, uncomfortable. Um, and as a nurse once told me, you're not here to relax. You're here to get over whatever you have and go home. So that stuck with me.
Your feelings about a nursing home or
I
a
would
facility?
never want to go to a nursing home. Never, ever.
You rather stay home?
Oh, please, yes. Please, yes.
Hmm. The next question is: have you ever been or gone to a nursing home?
Me personally?
Yes.
No.
Okay.
I'm not that old.
um. Okay. It while people are in nursing homes or in hospitals, do you think the patients are treated fairly?
No, not at all.
Can
I don't think that there's a level, excuse me, of fairness based on a variety of reasons. But no, I don't think they're treated fairly. If you complain too much, the nurse is going to take it out on you.
okay. And how do you feel about nurses, the doctors, or caretakers?
Well, nurses have a very hard job. Not only do they get yelled at by patients, but they get stomped on by doctors. So they get it coming and going. And what were the other ones?
Just doctors and caretakers.
Well, depending on if it's a male or female, female doctors are much more caring, compassionate. Male doctors should be flushed down the toilet. And just a caregiver in general, that's a hard job. That's a very hard job. I have empathy for caregivers.
Do you have a favorite healthcare related product?
Vitamins. I love my vitamins. Yeah.
Mm. And do you have anything that you use every day that works well, or something that you don't like using?
Well, I like having my vitamins every day because they help me out a lot. I mean, they play a significant role you know, in things that I need vitamin wise. But there isn't anything that I take that I don't like.
Just making sure about that
Yeah.
because bad products they can get thrown in the trash. Um, a lot of these are about hospitals. The next one is what do you have a story about when you've been in the hospital?
Okay, this is kind of funny. I have a habit when I'm anxious. of holding my hand to my chest like that, okay? So for some reason, I did not realize to doctors and nurses, this means you're having a heart attack. So I was in the hospital for something, I don't remember what, and they put me on the heart unit and had me hooked up to EKGs and all sorts of stuff. And they didn't say why. And they just did it based on the fact that I had my hand across my chest, which was just just kind of like a bad habit, I guess, you know? And I didn't find out until much later. The nurse said, well, we thought you were having a heart attack. And I said, you could have asked me.
True. They should have asked you before they started doing all that stuff.
Yeah, I wasn't having any pain or anything, but they had me hooked up to all sorts of stuff.
Yeah, and I feel like doctors should make sure that you're actually experiencing certain things, because they just hooked you up to something and that goes towards the hospital bill.
Right.
There's
That's
all
a male
sorts of
doctor
things.
for you.
Yep.
There you go.
Are there any stories that you heard from other people about nursing homes or hospitals?
Um, well, I've heard a lot of bad stories about Kaiser. That people have told me that they nearly lost a family member or somebody was treated really badly. But I've come to realize that all hospitals can have a bad story. You know, there is no one place that's worse or better than any other place. So,
Hospitals are just not the place to go to.
no, I try to stay out of it as much as possible.
Same.
Yes.
Even though I have actual things going on, I stay home. My mom just knows what to do. That's it.
There you go.
What is your largest concern if you had to stay in a hospital or a nursing home?
Well, I wouldn't want to be in a nursing home simply because you surrender your freedom and you're pretty much contained in one place. In a hospital, I fear someone giving you the wrong medication and killing you and not paying attention to what they're shooting into the IV bag. So, yeah.
That really is a large concern. That's
Yes.
kind of what my group is trying to avoid. When we come up with this little machine thing or whatever, we have some type of security thing to it, to where we make sure that each patient is getting what they actually need.
Right. Pay
Because,
attention.
Yeah.
Pay
just
attention
really
helps a
pay
lot.
attention. If a human can't do it, then maybe a machine can, but they're still,
Working on it.
yeah. still
Yeah.
working on that. Okay. What problems have you had with hospitals in general?
Being ignored when I was in a significant amount of pain. I had just undergone some rather invasive surgery, and they took me off to my room, put me in bed, and left, and didn't check back on me for, I don't know, it must have been an hour or so. And I started crying because I was in so much pain. But I didn't want to bother anybody. And somebody across the hall, some guy across the hall, started screaming at the top of his voice for a nurse to get down there and help me out. And that's why a nurse came down and gave me a pain shot. Because this guy across the room heard me crying. I thought that was so nice.
It takes other people to do.
Yeah. Well, they were just ignoring me. They would, and a lot of times they do that because they're like maybe real busy. They have too many patients to look at, and unless you make a stink, they're not going to come and look at you. That's sad.
Do you think there should be more nurses and doctors?
Oh yes, yes. They shouldn't have such a heavy load, a workload where people will get ignored, and that's when people, you know, they end up dying because they're being ignored.
Yeah. Understaffing is a big problem when it comes to the medical field.
Mm-hmm.
I feel like for something so serious, you should have tons of people.
They don't want to pay
to make
for
sure,
them.
But yeah.
That's
there's-
it. It's cost.
Because it costs a lot just for one new nurse to be trained. in a lot of places they try to just hire what they want to afford,
Yeah.
and then
And they go,
yeah,
whatever.
yeah,
Yeah, they don't
all
really
it is.
care. That's the bottom dollar.
Yeah, and then people end up leaving the hospital worse, or they do die. And I feel like they should hold hospitals and doctors and nurses more accountable for those
Oh,
who
and
have to suffer like
they cover for each other like nobody's business. It is. I've had an experience where a doctor did a surgery on my knee and totally goofed it up, and I had two screws in under my kneecap, and they started to back out. So he did the surgery wrong, and which ended up with I had to have a knee replacement. And several times people asked, well, you could sue him. And I said, you know what? That is a waste of my time. I am not going to put any more effort towards this individual than I've already done. So I got a knee replacement. I'm walking, talking. I'm happy.
that. As long as you're out here, it's fine.
Yes.
I feel like something like that happened with my mom because she has two screws and a pin in her knee.
Ah.
But I'm pretty sure that happened when she was way younger, because I remember her saying something about when she was in high school, she had torn something in her leg, but she didn't know. She was walking around.
Oh, probably a torn
Yeah,
meniscus.
something.
Yeah, it's a muscle.
Yeah. And I just remember she was walking around on it. Nobody saw a problem, and then I guess it took one doctor to see it or something, and she had to get something.
See?
Yeah, she had to get stuff fixed.
You would be amazed at the kind of stuff that passes in front of these people, and they totally don't see it or don't care to say anything about it.
And one problem with me, I have hearing problems. And
Oh,
it's
you
because-
too.
Yeah, from a young age.
Oh,
Because I have excessive wax in my ear,
Oh.
and my mom always has to use it's a tool that's used to pop bumps off your face.
yeah.
But because it's a little circle at the end, she uses it to get the wax out of my ear. And I have
Oh.
way more wax than the usual person.
So that would cause,
And,
okay.
Yeah, and it blocks my ear. And I think it's worse in my. I think it's worse in my left ear.
Oh,
But when I was a kid, I somehow got an end of a eraser stuck in my ear,
yeah.
and it blocked off my hearing, and I couldn't hear. My mom was trying to figure out why. She
No
was
one
yelling
could
my
see it?
name. Well, no one could see it at first until we went to the hospital about it.
Ah,
But we didn't go to the hospital about it until my mom started realizing I couldn't actually hear her when she was yelling my name and stuff. And then she would ask me, she was like, "Do you hear me?" And I would tell her, "No, I can't hear you." And she took me to the hospital, and then that's when the doctors went in my ear and they pulled out a big chunk of wax along with the eraser.
wow. My only excuse is old age. Because as you get older, your hearing starts to go. And I'm constantly being told, why are you yelling? Well, in my head, I'm not yelling. I'm just talking loud because I can't hear.
Yeah, it makes sense. Because if you can't hear yourself, then you're not sure.
If I'm
Other
talking
people-
loud enough,
Yeah.
yeah.
That's understandable. But also with my wax issue, it just builds up, and then it just creates a hard chunk. And
Sure.
I've gone to ear doctors multiple times, and they keep putting the thing in my ear, and they're like, "Oh, I don't see nothing. I don't see anything." But then I go home, and my mom, she digs it out. There'll be a whole bunch,
Right.
and sometimes.
So this is just natural
Yeah.
for you.
Yeah.
So you should just let your mom take
Yeah,
care of it.
And that's it. I stopped going to the hospitals for that.
Yeah.
I just let my mom do it.
Just because she's careful, she's not going to puncture your eardrum, and she knows what she's doing.
Yeah, that's crazy. My mom's not even a doctor, but
She still
It's
knows
her
what she's
hospital.
doing.
yeah. Okay, these are some imagine questions. If you could eliminate one disease or alignment from the world, what would you choose?
One disease. Well, there's a lot of parts to this disease, which would be cancer, because it comes in many shapes and sizes. But it still is cells in your body going wacko and attacking you, and there could be a cancer of the blood, cancer of the brain, but it's still cancer. So, yes, I would like to eliminate that
Yeah.
because it would take care of a lot of different
A
things.
lot of things. And also, there's all this medication out in the world, and cancer is still
Killing people right and
big
left.
problem.
Yeah.
Okay. If you had control over pharmacies and medicine distributors, what would you change?
Their bottom line. They don't need to make $50 billion for something that doesn't cost maybe $1.50 to make. So the price of drugs is ridiculous. It doesn't take that much to make certain drugs, but a lot of drugs went overnight from being like $100 a month to being $7,000 a month. So their bottom line needs to be adjusted.
When it comes to medication, can you read the labels properly? Because some of them have small writing.
Oh, yeah, yeah. I can read them. And if it gets that small, I'll get a magnifying glass out because I like to see, the potentials for this could cause. I would like to be aware of those kind of things.
I feel like they should put a bigger label for when it comes to side effects and stuff because there's no telling what could happen.
See, and I know I have had side effects from different medications, so I'm very conscious of reading them, even if I have to use a magnifying glass.
Just making sure. What would be? Oh wait, let's get this up. What would you do if you saw a little robot machine giving you your medication?
I'd be suspect. What are you going to say to a robot? Are you sure, Mr. Robot, this is correct? No. So I would not entertain the thought of a robot doing that. I would not feel comfortable.
Okay, you'd rather have a person.
Yes, I like to deal with people. I like to look at your face, see the smile on your face. Yeah.
What if the robot can smile?
I don't care. I don't trust the robot.
No robots. Okay. And what would the perfect hospital or nursing? Yeah, I know you don't like nursing homes, but it's just in the question. What would the perfect hospital look like to you?
More nurses, less male doctors, more female doctors, and I know this is hard, but more caring about everybody, not just certain people, but everybody. Yeah, no selective patients.
Because that's a problem too, especially when they bring in racist doctors.
Oh, please.
That's something.
Yeah, you might as well go shoot yourself. I mean, they're not going to take care of you. They've already got a bias against you. And I don't know if men, I would think men were more racist than women. Because women have a natural tendency for caregiving that men don't. And so I can see people getting the worst treatment possible because the doctor's racist or doesn't like their religion.
Yeah, that's a big problem. Because why would you go in a profession like that knowing that there's going to be all sorts of people
Well,
coming in and out?
power is a weird thing. A little bit of power, especially with someone with a massive ego, can get out of control. Yes, that's a male doctor. Yep.
No male doctors.
No. I can leave them all. The person that did my knee replacement was a female doctor.
All right. Well, thank you.
Oh, you're welcome. Here's your little thing. I hope I did.